equals great rates.
Hospitals across America are making plans for the possibility, no matter how small, that Ebola could spread in the United States. The threat comes at the same time hospitals are on high alert for another disease called Enterovirus. Doctors say it killed this preschooler in New Jersey and sickened more than 500 people in 43 states so far. And on top of that, flu season is just about ready to get started, and analysts say hospitals could begin to feel the strain of it all. Joining me now is Dr. Michael Anderson. He's the Chief Medical Officer for Critical Care at Cleveland University Hospital's Case Medical Center. He's also a consultant to the CDC and the Department of Health and Human Services National Disaster Medical System. In other words, doctor, you're doing a whole lot for a whole lot of people. So let's get to it.
It's a busy time.
It is. Let's start with that triple threat. What do we need to know?
Sure. Going into the fall, we're always prepared in hospitals for flu season. Some flu seasons are easier than others, so we prepare for a lot of patients. There's another virus called Enterovirus D68 that's really ramped up actually in the summer, but we're still seeing cases of it, including that unfortunate young child that you spoke about. So as you look at the landscape, we're always ready in the fall for a very busy viral season. But now if you add a couple of different viruses in, I think it's time for an abundance of caution to make sure we really are prepared, and we're prepared for what's called surge. Can we increase the number of beds in our institutions, in our systems, to take care of potentially this large number of patients?
Did you say surge, like surge planning? That sounds like war.
Well, it's not war. It's really good planning, right? You want to prepare, and if you over-prepare, that's a good thing. But if the hospital becomes full, if your system becomes full, really what are you going to do? I think the chances that we're going to have to do that are very, very low. But I think if you're a good hospital planner, a good preparedness person, you're asking yourself those questions. What are we going to do if November gets really busy and December is even busier?
Yeah.
How are we going to surge up in the number of patients that we're seeing?
Well, you just must scratch your head when you look at the situation that was created down in Dallas, Texas.
Yeah, it's a very difficult situation. I would tie together a couple of the wonderful reports that you had earlier in the program. Number one, I agree. I think it's a good sign that a lot of hospitals are reporting to the CDC, and so far none of those patients have proven to have Ebola. I think that's excellent. And I do think there's a lesson here that we here in university hospitals in Cleveland are really making sure that our ERs are monitoring. Have you been to West Africa? Have you had contact with somebody that's traveled to West Africa? It's a very important but really pivotal triage question.
All right, doctor, before I let you go, out of all of this, what is your main concern? Because as I'm reading, Ebola is very, very remote in terms of any sort of pandemic here in the United States. But what are you really concerned about? What do people really need to know in terms of preparing for the season?
You're right. I think that our federal and our non-federal colleagues are doing a really nice job of containing Ebola, and I would agree with the previous reports. I don't believe there's room to, or reason to panic, if you will, on that. I'm just a little concerned that if we do add D68, there's another virus called RSV that's a pediatric disease in our children's hospitals. If you add all those numbers up and it gets really busy in the fall, it could be a very busy season for us.
Yeah, RSV, that's a respiratory illness that little ones get. I'm very familiar with that as a mom. Dr. Anderson, we appreciate your time. I know you are on social media, so we may go back and forth a little bit later with viewers because I know they have a lot of questions. Thank you, sir, for your time.
Thank you. Well,
something weird is going on. That's the word from the family of a missing Utah woman who left her apartment with no money, no cell phone, no shoes. That bizarre case when we come back.
Who says